Welcome to our presentation on sustaining effective service integration in rural and regional communities. My name is Associate Professor Cathrine Neilsen-Hewett and I'm the Director of the Early Years here at the University of Wollongong, and I'm also the Director of Pedagogical Leadership at Early Start. And I'd also like to introduce my two co-presenters, Stouse-Lee and Alysha, who will be sharing part of our journey with you today. Before we begin, we'd like to acknowledge the traditional owners on the lands at which we stand. We're here at the University of Wollongong on Dharawal land, so we'd like to pay our respects to the Wadi people of the Dharawal Nation and our respects to elders past, present and emerging. We also just want to thank and acknowledge the dedication of the many educators and professionals who've really supported us in this journey thus far. So the project that we're going to be sharing with you today is really around shining a light on service integration in regional and rural communities. And I guess the importance of integrated service platforms to optimise outcomes for children and families has been widely recognised both nationally and internationally. And I guess because of this importance, we're really seeing an increasing activity around service integration in Australia, with growing numbers of what I would describe as one-stop shop kind of place-based initiatives. And while these might work in metropolitan communities, this is often not a viable option for communities in rural or regional areas where allied health services are often scarce or even non-existent. So the SESI project, which was funded by the Ian Potter Foundation, is really about establishing a framework for sustainable and effective service integration across these regional and rural communities. But it's also about identifying gaps or challenges that work towards addressing these issues or gaps through evidence-based professional learning. And our approach recognises and addresses the unevenness of access to services within regional and rural contexts. And it also highlights the need to develop systems and professional learning supports that are contextually responsive and really build educators' capacity to achieve effective outcomes for the children and families that they're working with. So as you can see from the model here, our framework for service integration differs in that it places the early childhood educational service at the structural heart of the service integration model. And for many vulnerable families, the early childhood educational service might be their single or only point of access into the service system. So what this model does is it recognises this and works to support the early childhood education services to connect, to collaborate, to integrate more effectively across the range of health and early intervention and family support services that do exist within their communities. So this slide really captures our 6 interrelated aims that sit under these 2 umbrella goals. So we know if we are to place early childhood education at the centre of our service integration model, then effectiveness of this model really rests on the effectiveness of educators as well as their approach to pedagogy. And we also need to think about their ability to connect with the key stakeholders across their communities, as well as the establishment of strong and collaborative communities of practitioners. And that's both within the service, but also across the services. So given our project is really focusing on capacity building, a significant component of the SESI intervention, which I'm not going to unpack in today's presentation, but at the same time it's really important for you to be aware of this, is really around improving educators' pedagogy and practice and enhancing their knowledge and their capacity to support children's development and familial engagement. So in today's presentation, Kim and Alysha are going to share with you our initial baseline community and service audit, and this was a really important component of the project as it paints a picture of the current gaps and challenges that exist within our focus communities, but it's also been an integral process to our approach to co-construction and co-development that's occurred alongside those participating services.
The purpose of Phase 1 was to investigate the level of integration between 6 early childhood education and care services and the allied health and support services in their communities. The project aimed to evaluate if family and child needs were matched with access to wider service provision and to identify barriers that were restricting successful integration, along with the role of the early childhood education centres in service integration. This slide illustrates the planned longitudinal project, interventions and measures. Note the COVID restrictions have paused the research and intervention activities for 2020, however they are on track for 2021. This project adopted a responsive research model, Significant project development took place in 2018 prior to the commencement of Phase 1 in 2019. The three key principles of the collaborative design included developing a contextual framework, engaging a collaborative response, and being relationship focused. Phase 1 of this study involved the collection of exploratory data at 3 different levels. 1. The SESI project embraced the knowledge, skills and experience of a diverse range of professionals to develop a collective response to challenges of service integration at a systems level. This included collaboration with peak organisations, allied health and service providers. 2. The SESI project carefully considered the requirements and constraints at a local community level to develop strong contextual frameworks as a foundational design principle. 3. The SESI project collaborated closely and focused on relationships to better understand the 6 participating services, the needs of the enrolled children, and the current level of inter-service collaboration. The project initially embedded a SESI reference group to bring all levels together in a collaborative design. The reference group had clear terms of reference to ensure there was an informed collective response to project planning. Sector experts included representatives from NOAA's inclusion services with experience in NDIS and multidisciplinary teams, the Parenting Research Centre with experience in child and family support, and Our Place with integrated service expertise, policy, research and engagement experience. Reference group meetings have provided a forum for directors from each of the early childhood education and care centres to develop a secure and reciprocal relationship with each other, sector experts and the Early Start project team to form a community of practice. A multi-level audit was used to capture contextually rich data. This included the completion of semi-structured interviews with integrated service providers, an online audit of each community's allied health, community services and profile presented as a service map, facilitated focus group discussions with educators and directors of each participating early childhood education and care service, and questionnaires exploring each early childhood services staffing. All the children's services in the project were licensed long day care centres on the south coast of New South Wales, Australia, across 3 local council areas. The centres were approved to enrol 39 to 59 children per day, including infants, toddlers and preschoolers. All centre directors were qualified or working towards university-trained early childhood teachers. The service management comprised of 2 council centres, 3 part of larger not-for-profit non-government providers, and 1 Aboriginal Corporation managed centre. The socio-economic indexes for the areas, or CEFA, ranks geographical areas in Australia according to relative socio-economic disadvantage. There are 10 decile bands. Suburbs in band 10 are the most advantaged, while those in band 1 are the most disadvantaged. The 2018 census identified that SESI project centres were located in the areas that ranged from 1 to 2, with 4 of the centres being ranked in decile 1. This represents a significant level of comparative community disadvantage compared to the New South Wales state data. The Australian Early Development Census, AEDC, provides a national measurement to collect data relating to 5 key domains of early childhood development known to be predictive of children's success and identify levels of vulnerability. The SESI project used the AEDC data as a measure to understand child vulnerability at a community level. The 2018 data demonstrated that combined, the SESI centres had on average 26.1% of children vulnerable in one developmental domain. This was comparatively higher than the New South Wales average of 19.9% of children, and 15.18% were developmentally vulnerable in 2 or more domains, compared to the 9.6% state average. Understanding the context of communities underpinned the responsive model of the project.
By data drawn from the online audit and questionnaires were used to develop a profile of each participating centre, their communities and the services available to them. Interviews and focus groups provided insight into the extent to which centres accessed available services, worked collaboratively with such services and the barriers restricting for integration. To interpret the data, content analysis guided by the SESI model of service integration was completed. This analysis revealed a number of key themes around child and family, ECEC, health, family support, integration and learning. In terms of the child and family, our content analysis revealed that each centre had an extensive understanding of their child and family needs and individual circumstances. The conversations focused predominantly on what happens within the centre to support children and family. However, it really extended into the home learning environment, or the community at large. In these discussions, an underlying view also emerged, in which educators saw families as the primary factor determining whether a child receives the support they need. Looking more closely at the EC setting, the content analysis revealed that when determining strategies for support, educators generally drew on their own knowledge and experiences, their colleagues, or from a network within the ECEC community, as opposed to connecting with experts or working with families to problem solve. Where educators collaborated with experts and families, this mainly occurred where strong relationships were established. Finally, staff wellbeing issues, such as burnout, were identified as key barriers to service integration. In terms of family support, ECECs provided internal assistance, namely through being a confidant of parents. In addition to this, many provided outreach support to get children on waiting lists, such as calling on behalf of parents, as they indicated that many families did not have the relevant knowledge of the system to be able to navigate it. Finally, a number of the ECECs had links to parenting support programs, such as Brighter Futures or playgroups. But this was not universal, and the number of parents who accessed this support was not clear. There was a distinct barrier in terms of access to health specialists, such as paediatricians and ENTs. This results in long waiting lists, families not always attending follow-up appointments due to travel and cost barriers, and a disconnect between educators and healthcare providers. In addition to this, it was evident that both across and within centres, there was no systematic way to connect with health services. Centres generally rely on a particular individual's knowledge of the system to make or obtain referrals. Connections are not established centre-wide, leading to a loss of connections to a service when individuals resign. Integration between services in all areas was limited. Where intersector collaboration does occur, it is generally focused around speech and occupational therapy. Educators noted that they did not feel confident about their knowledge of external services in terms of the range of services available, what different services do, how to refer, and how to develop such relationships. Finally, a significant barrier raised by all centres was that of program and service attrition as a result of changes in funding, relocation of experts, or a breakdown of relationships. In terms of learning, all ECECs had great connections with local schools. However, as aforementioned, programs and service attrition due to funding cuts limited the learning and support available year to year. In terms of educators' learning, there was a clear issue around access to PD, again either due to location, funding, or backfill issues. Finally, there appears to be a disconnect between supporting children's learning while they're in the centre and supporting children's learning at home. This preliminary data collection has provided us with great insight into the communities we are working with and the significant needs of each centre. Adhering to the responsive research model of implementation, this data will be used to inform targeted professional development and coaching and mentoring sessions throughout 2021. This will be followed by the collection of longitudinal data in 2022 to evaluate the impact of this intervention on ECEC centres and their knowledge, access and collaboration with allied health and community support services.